Worried about dentures during and after facelift surgery. Any suggestions? I have dentures and they fit fairly nicely. Most people don't even know I don't have my own teeth. I'm positive that I am going to have a facelift and have booked my consultation. My biggest worry is about my teeth. Will I be able to wear them immediately after surgery? My significant other has never seen me without them, and although I know he loves me, I don't think I am ready for that day yet.
Thank you for your question. Your question is concerning the situation you have with the wearing of dentures during and after facelift surgery. You expressed a concern about your significant other not having seen you without the dentures and how natural they look, and you're not sure. You're certainly concerned about the fit and how the effect of the surgery will be on the wearing of dentures. Well, I can certainly give you my perspective. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic reconstructive surgeon, practicing in Manhattan, Long Island for over 20 years. And facelifting surgery is a very significant part of my practice. And I can tell you how I have dealt with this issue in my practice. So to begin with, I feel that with facelifting surgery, technically, as far as the fit of dentures, it should really not be an issue. That's with the understanding that you're not having any type of chin implant, which also should not be an issue either because of the way dentures are fit. But I would say that there is a differentiation that I would put out to you that I feel is important, and how and why my procedure has evolved the way it has over the years. When I was in training in facial cosmetic surgery, a lot of the facelifting surgery was done, in fact the majority was done under general anesthesia. And it was always my question that when a person is under general anesthesia, when they have a tube in their mouth, the patients had to remove their dentures and remove the bridges or anything that could potentially be dislodged and have a potential impact on the airway or breathing, that there were so many structural aspects to the person's face that were being distorted. So I always thought, are we doing the best job we can on a patient who has all of this distortion, whether it's from the tube, whether it's from the absence of the teeth in the critical location. In my practice, we do everything under local anesthesia with light intravenous sedation. And when I say light intravenous sedation, it truly is light. It's light enough that a person can be easily woken up. And the reason is that once the area is numb, we can do this procedure very comfortably, and I can get the patient's cooperation to mold and shape the skin in a way that I want to. And so I routinely allow my patients to wear dentures during the procedure. Now, of course, every patient that decision is made on a case-by-case. If there is any potential risks that would be an issue, then we have to discuss that. But I feel that the local anesthesia with very light sedation is an ideal way to have a procedure if you want to ensure that the dentures and the look is optimized with the dentures. So to answer the question about the fit of the dentures, I don't think it'll be an issue. But I think that in terms of getting the optimal result, my personal preference is to do it with the dentures in place so that it is as close to your normal life as possible. And it's one of the reasons why I feel that our patients do very well. They heal faster, they look natural, and they just really are able, in my hands, get what I think is the most ideal result, because their faces aren't paralyzed by the general anesthesia effect, nor are they distorted from the tubes and other things that are needed when a person is put on a respirator under general anesthesia. So I think you should meet with doctors, learn about how they do their procedure, take this perspective with you in terms of that decision-making process, and see what you're comfortable with. So I hope that was helpful. I wish you the best of luck. Thank you for your question.